I'm Mrs Fishlock and I teach child development. The OCR Cambridge National Child Development course has the full range of grades that a GCSE course will have, right down from a pass at level 1 all the way up to a level 2 distinction star, which is sort of the top of the GCSE range of level 9. The course is divided into 3 units. RO18 consists of 5 learning outcomes that will all be studied and then an exam taken in them at the end, and it's a single written paper of 1 hour 15 minutes. Then there's 2 pieces of coursework, RO19 and RO20. They're both worth equal 25% of your final mark, and you'll complete one of those in year 10 and one of those in year 11. There's 5 learning outcomes in RO18, and we're going to take a little bit of time to look at each of those now. Learning outcome 1 focuses on the reproduction and the roles and responsibility of parenthood. We're going to look at topics such as factors to consider before having children, preconception health and how you can keep yourself healthy, the roles and responsibilities of being a parent, contraception, the different types and how useful each one can be, and the function and structure of the reproductive systems. Learning outcome 2 focuses on the antenatal care and the preparation for birth. So we look at different healthcare professionals, what the routine antenatal checks and scans are, and then we look at the specialised antenatal checks and scans. We look at the different choices for delivery, the different stages of labour, and the different options of pain relief that will be available. Learning outcome 3 focuses on the postnatal checks, parental provision, and conditions for development. So the postnatal checks for a newborn baby and the specific needs of a premature baby are going to be slightly different. There's different postnatal provisions for the mother, for the baby, and for the family as a whole. And we'll look at the conditions for development so that your child will thrive. In Learning Outcome 4, we're looking at how to recognise, manage and prevent childhood illnesses. We look at immunity to disease and infection and how it can be acquired, either naturally or artificially. We look at recognising common childhood illnesses and when you might need to seek help from a doctor. Some illnesses can be diet related, and we also need to look at what ill children need and how to prepare a child for a possible hospital stay. Learning Outcome 5 focuses on child safety. We look at creating a safe and child-friendly environment, look at safety labelling for clothes and equipment. We look at common childhood accidents and how they can be prevented, and social safety such as stranger danger and using the internet. So the 2 coursework units are RO19 and RO20. They're worth 25% each, and we're going to have a little bit of a look at each of those now. RO19 focuses on the equipment and nutritional needs of a 0 to 5-year-old. So you're given a situation where there's a nursery that you need to choose equipment for 2 different rooms, one being a baby room, 0 to 12 months, and one being a 1 to 5-year-old's room. You're also going to look at nutritional needs for children from 0 to 5 years. And then you're going to investigate a feeding solution. So you will have one practical lesson that you will plan for, complete, and then evaluate. RO20 is about the development of a child from 0 to 5 years. So you really could do with access to a child within that age bracket, although it's not impossible to do the course without. In this unit, you will look at the physical, intellectual, and social development norms of a child from 0 to 5 years. You'll look at the benefits of learning through play and the different types of play that they can learn through. Then you'll do a very small child study where you plan activities for your chosen child and then carry them out and then evaluate them. I'd like to address some common misconceptions about this course. The first one being that you're going to get a fake baby to look after. No, you're not. The fake babies were part of an old GCSE child development course when there was a much longer child study that had to be completed, and you don't need to do that for this course. The second misconception is that childcare is just for girls. No, it's not. Male workers in the childcare sector are in demand, so employers may seek male role models. Currently, men get promoted faster than women in this sector. The third misconception is that childcare is an easy option. It's an easy course to take. This one might be true. If it's a course you are really interested in and you really enjoy it, hopefully you will find it easy. However, the course is a full level 2 qualification and it's the same level as any other GCSE. It's easy if you enjoy it. The common misconception number 4, childcare is about working in a nursery. No, it's not. Childcare sector can lead you to so many different careers, not just working in a nursery. For example, a paediatric nurse, sports coaching, being a holiday rep with children, and a teacher. Final misconception is that childcare is about just working with babies. This course teaches you about children of 0 to 5 years. By 5 years, they're definitely not a baby. Lastly, I'd like to talk about where this course could take you. This could lead you to a career as a teacher, as a midwife, a doctor or nurse or other healthcare professionals. It could take you into childcare at a nursery or outside of a nursery setting. How about an educational psychologist or a police officer or a social worker? They all need to be able to interact and have knowledge about children. Any of those could be for you. I hope that's given you a good idea of what's involved in the course, and if it sounds interesting, this is the course for you.